Dr. Tan Wu Ming.
Mr. Speaker, sir, my response today will also address the PQ filed by Mr. Yip Hon Wing, which is scheduled for a subsequent sitting. The COVID-19 pandemic has posed a severe dilemma, summarized as lives versus livelihoods for all regions in the world. You close the borders and lock down society can save lives, but people will suffer tremendously from economic paralysis, and children held back perhaps permanently in their learning. You open up society and economy to resume normalcy quickly, but many people will suffer from falling severely ill and die from infections. Every region in the world knows it has to strike a very careful balance between lives and livelihoods. 3 years into the pandemic, Singapore has been able to open up our society and economy with life almost going back to normal, and yet we maintain an excess mortality rate that is one of the lowest in the world. In September 2002, MOH released a public report on the excess deaths in the Singapore resident population over the pandemic. Between January 2020 and June 2022, there was an increase of 24.9 deaths per 100,000 persons per year, using pre-COVID year of 2019 as a baseline. So our death rate during this pandemic essentially brought us back to 2018 levels, wiping out improvements over a few years. The World Health Organization uses a slightly different methodology to compute excess deaths, but the results are similar. Based on the WHO estimates for the years 2020 and 2021, Singapore experienced 26 excess deaths per 100,000 persons per year, compared to our estimates, which is 24.9, so about the same. But it's still, again, much lower than many countries, especially those that have opened up, like us. Members have asked for a breakdown of the numbers by year. So if we break up our estimated excess deaths, there were 1,140 from January 2020 to December 2021, and then 1,350 from January to June 2022, respectively. There are two ways to reduce excess deaths associated with COVID-19 pandemic. The first is vaccination. COVID-19 vaccination plays a big part because it significantly reduces the risk that infections translate into severe illness and deaths. The fact that Singapore got 93% of our population vaccinated, and that base includes children that are not eligible, and 80% boosted, is a key reason why we have low excess deaths. To answer Mr. Yip Hon Wing's question to be scheduled for another sitting, in the same vein, in Singapore and elsewhere in the world, unvaccinated persons disproportionately contributed to COVID-19 deaths. In the first half of 2022, about 5% of eligible population are not fully vaccinated, but they contributed to 28% of COVID-19 deaths. MOH does not comprehensively track the number of persons who are medically ineligible for COVID-19 vaccination. However, as of 30th June this year, the number of persons who applied to be exempted from VDS, Vaccinated Differentiated Safe Management Measures, they claim they have adverse reactions to COVID-19 vaccines, and we look at them, and we have granted 2,100 of such exemptions. For this group, the observed rate of COVID-19 deaths in these individuals was about 2 in 1,000, compared to 0.3 in 1,000 observed in the whole population. So again, this is the group who applied to be exempted from VDS. In reality, the number of people who are medically ineligible for COVID-19 vaccine is very small, given the choice of vaccines that they have access to. It is worth reiterating here that to be properly protected against the Omicron virus or COVID-19, we need to get a booster. In other words, 3 doses of mRNA vaccines. It will reduce the risk of severe illnesses and deaths significantly. 2 shots do not do the job properly. We are currently bringing in the updated bivalent vaccines that can offer better protection against variants. The second factor is whether the healthcare system had been overwhelmed at any point during the pandemic. The second factor to excess deaths. Overwhelm is not the same as hospital being very busy, which ours have been and is still very busy. Overwhelm means there were so many severely ill COVID-19 patients that the hospitals ran out of beds, ran out of oxygen, ran out of medical staff to take care of them. Patients are essentially left to demise. And whenever a bed or an equipment becomes available, doctors have the unenviable task of choosing who should they save amongst everyone that's waiting. When that happens, many non-COVID-19 patients, such as those with heart attacks, injuries, strokes, will be affected, and without proper care, many of them will also die. And that happened in many countries. In Singapore, we did not let that happen. Mostly because when there was a risk of that happening, we went into circuit breaker mode or went into heightened alert mode to slow down the rate of infection to protect our healthcare system. Hence, throughout the pandemic, despite our public hospitals being strained while coping with the pandemic, our hospital and ICU beds were able to support patients with urgent medical needs. Looking ahead, we can continue to prevent deaths by preserving healthcare capacity and ensuring that our healthcare workers are well-resourced in such situations. If and when there is a surge in infection and severe illness numbers, we cannot rule out the reimposition of safe management measures. But we will only do so when it is absolutely necessary to save lives and to protect the healthcare system. What we managed to achieve is due to the fact that the great majority of our people did their part and did the right thing. The pandemic is not entirely over, but we hope we are at the end game and will continue to navigate through the crisis with resilience and unity. Thank you.
Dr. Tan Wu Meng.
I thank the Minister for his comprehensive answer. I've got one supplementary question. Does MOH and the government have plans to study more deeply the impact of socio-economic status as well as housing type on the excess mortality risk from COVID-19?
Thank you for that suggestion. It's a good one, which we have a Sosui Hawk Public School. Maybe that's something they can look into, but so far we have not compiled those numbers. But if we look at the literature and our own experience, the two main drivers for excess deaths has been first, are you vaccinated? Second, your age. And I think that will continue to be the case. Notwithstanding, it's an interesting line of inquiry which our researchers will definitely look at.
Sri Bon Wing.
Thank you, Mr. Speaker. I thank the Minister for his reply. I have two SQs. First, with more data, does MOH intend to periodically review the vaccination eligibility criteria to allow more people who were previously ineligible for vaccination to get vaccinated and protection from COVID? Second, how does MOH intend to increase the vaccination rate, especially amongst those who are seniors and have comorbidities? Thank you.
On vaccination eligibility, the question is actually the other way around. We will very much want people to be vaccinated, but usually it's the resident who come forward to say, I'm not eligible. I got eczema, I got this, I got that. And then some are not so valid medically. Others, we have to take a close look, especially if they have some adverse reaction after their first shot. And they then may become ineligible. And that is a medical indication which we will have to respect. Notwithstanding, we bring in different types of vaccines now with different technological platform, and hopefully they will be able to take one of them. Second, how do we further increase the rate of vaccinations? We have to keep on explaining why it is beneficial to vaccinate. we have to get a momentum as more and more vaccination begets vaccination. When you see more of your friends, your relatives vaccinate, you also, notwithstanding some hesitancy, will go vaccinate. So we got to bring vaccination to the community, which we are still doing so through our mobile teams. And also for those who are not mobile and stuck at home, we will go to their homes to provide the vaccination. But as mentioned in this House earlier, we are trying to move to a new definition of up-to-date vaccination. Today, vaccination is pretty much all covered. Whoever is holding out probably is very hesitant, unable to change their mind, or indeed have medical indications and you can't, contraindications that you can't vaccinate them. Moving forward, it is more the booster rate. And I think we should move to a stage where we stop counting the number of booster, 1 booster, 2, 3, and so on, but move to a concept where you really live with the virus, closer to how we live with influenza. Every year when there's a season, take an influenza vaccination that will protect you throughout the year. And I think we need to, as we gather more data, as we have the shipments in, operations are ready, we will announce the details and move to a new mode of vaccinating the population.